bunch of little facts here and there that we try to put together. So for example, there's been research showing that women with migraine have a higher kind of energy expenditure, daily expenditure, than women without migraine. There's also some ways to score your oxidative stress level and ways to look at the brain with magnetic spectroscopy showing metabolic and mitochondrial abnormalities. We also know that people with mitochondrial disorders, mitochondria are key players in metabolism, have a higher risk of migraine. Is that the same mechanism that's underlying other people who have migraine? We yet don't know. So thinking about, for example, obesity, there's many ways that obesity could play a role. You know, just the fat itself is inflammatory. It plays a role in posture. It also changes the microbiome and the way that the gut lets different substances enter the circulation. So, but how can one master glucose levels, for example? So someone who is obese will have insulin resistance. And if you do have insulin resistance, you're more prone to have those changing and high sugar levels that are not very favorable for the migrainous brain. Is there insulin resistance in the brain itself? We know about insulin resistance in the body, but we now know there is also insulin resistance in the brain. And that is a question that could play a role, something that could play a role into migraine chronification.